Okay, so we have an anterior open bite case. These can be a little bit more trickier, but definitely doable in Invisalign. So I have a patient here with anterior open bite, severe overjet due to a class 2 malocclusion. Most of the time, patients don't know that they have a class 2 malocclusion, and adults tend not to do elastics very well. But patient's main chief complaint isn't about her overjet, but more so that when she bites down, she thinks it's not biting properly and that her interiors are open. So first thing first, there are very just simple 7 steps that we can follow to close these anterior open bites. And first thing first is that we make sure if there's any teeth extruding, we put in attachments. For the upper, we do prefer optimize expansion or extrusion, and for the lower, same thing, optimize attachments or ellipsoid. For the mandibulars, work great. Um, the second thing is we check the occlusion here. And at the beginning, if we see any teeth that are occluding in the posteriors, we intrude them. So you can see here number 2, 31, 30, 29, all the teeth that are has an occlusion right now, they'll all be intruded. Because these open bites most of the time happen because they're hitting prematurely in the back. So same thing on the top. So all these teeth that have some contact, they're going to have some sort of intrusion. We are most of the time we're not going to use a bite ramp. We typically do put bite ramps to make sure we don't have posterior open bites in the future and that the bite settles. But in this case, we want to get rid of them so that sometimes they can cause continuing to have an open bite. Another thing is we want to make sure we want to go slow. What I mean by that is some providers may suggest wearing it only for 7 days or 10 days per tray. We want to make sure we wear it for at least 2 weeks per each stage. That way we can ensure that everything is tracking well. Again, back to the occlusion thing, we want to make sure no posterior teeth are extruding. And very important tip here, we want to make sure we want to expand the arch much as possible. So if you can see right here, we're expanding quite a bit. This is going to be our best friend. We need to expand the arch if we want to close that open bite. Okay. And when we expand the posteriors, we want to make sure that we do give some lingual torque to the posteriors here. Because what happens a lot of times that you can get a hanging palatal cusp. We don't want that. So we tell Invisalign where we manually kind of control it to make sure there's no hanging palatal like this. We want to make sure we close it up. So at least put 6 degrees or so of um, palatal inclination on the roots, okay? And finally, IPRs are going to be very beneficial in order for us to expand. Um, Retracting teeth naturally deepens the bite through relative extrusion. And an IPR is not what you want with a deep bite, but it absolutely helps with our open bite situation. Look at the comments below for a summary of each of the steps. Thank you.